Hello, and welcome to our last case study related to RS-3060, where today we're going to be discussing the topic of arthritis, specifically following up the case related to Ruth in terms of, based on her history, whether we suspect that rheumatoid arthritis could be present based on the classification system that we reviewed in lecture. Now, I could take the case and break it down, reading over each point as it's presented, but as we've discussed in previous cases, sometimes it makes sense to try to summarize things in different assessment categories. So we're actually going to take the opportunity to do so here. Notice some of the different categories that we've used previously in the past. So we're going to try to break down some of the relevant points of note, especially as it relates back to the presentation. So if we were to take our case and summarize it in different assessment categories, it helps us to make a little bit more sense on the presented information. So if we were to look at some things that may hold importance in the suspicion of rheumatoid arthritis, for example, there's some discussion related to the limitation of ability to try and straighten the knee due to some stiffness. That may highlight the presentation of some swelling that could be present, and that may be found in the knee, or the ability to dorsiflex or lift the ankle also due to stiffness. Muscle weakness may also highlight underlying systemic changes, and that could be a marker. Of importance to us here also is some of the complaints of joint swelling, pain, fatigue over the past 2 years. So a past history of this particular current condition, giving us a sense related to the timeline. The diagnosis of knee OA and fibromyalgia, that may hold some relevance in terms of how it may impact on Ruth's gait, on Ruth's movement, and if it could be a provocative factor. Some other things we can assume are fairly unremarkable. If we were to place in there social habits, family history, living environments, health status, there's really nothing in the case that was really provided for these aspects. So we would presume that they're overall doing okay. But we do have some aspects in the history of the current condition, past history, and even the past medical and surgical history that could hold relevance in giving us an understanding of rheumatoid arthritis is a factor. Other things of note. On examination, the limited bilateral shoulder, elbow, wrist, finger, range of motion, again, that can relate back to swelling. That is a cardinal sign of inflammation. Swelling, warmth, and tenderness in both wrists, both MCP joints, 2 through 5, both knees, both ankle joints. So numerous joints that can be involved, presenting with signs and symptoms of inflammation. X-rays did not denote any degeneration, and sometimes X-rays will be ordered to further isolate if there is underlying progression. As we know with rheumatoid arthritis, over time it can progress to the point of joint degeneration or joint erosion. Blood tests are within normal limits. That is also importance related to categorization. Blood pressure, respiratory rate, heart rate, normal. Rest and heart rate increased to 92 with modest physical activity, and that's not entirely out of the norm. You'll have an increase of heart rate, and that heart rate level really isn't too worrisome for us. So again, there's a few things here that are unremarkable. But the presentation of inflammation, the number of joints that are involved, the length of time, and the findings on blood tests, all of them are going to come into play related to categorization. So let's look at that. So in review of the case and review of the diagnostic criteria, would Ruth be diagnosed with rheumatoid arthritis? In this case, for conclusion, yes. Breaking it down. In terms of joint involvement, we have multiple joints that are involved. We have knees and ankles, and those are going to be deemed as large joints. And then we have multiple small joints. So we have 8 small joints, 4 large joints. That is greater than 10 joints, and at least one of those is a small joint. So that's going to be 5 points. Keep in mind, if you had 1 large joint, a knee or an ankle, that's really not going to give you many points. 2 to 10 large joints would only give you 1. This is rheumatoid arthritis. We consider that more likely to be present in the smaller joints overall, which is why we highlighted that yes, has 4 large joints, which would be 1 point, but we have 2 small joints in the wrist, 8 small joints MCPs, so that's significant enough where there are more than 10 joints, and that's why we have 5 here. Related to blood tests, we look to see if we have a rheumatoid factor. A low amount or a higher amount is going to give us more so towards points here. We don't have blood test findings that correlate with that, so that would be 0. In case you're curious, the ACPA, that is an antibody value. So we're looking to see if it is negative, or there's a low amount of positive findings, or a higher amount of concentration that's within there. So again, if we have a normal blood work makeup, then that would be deemed as 0, no points for that. Another aspect related to the blood test is related to acute phase reactants. This is where we're looking at things like erythrocyte sedimentation rate, and that's where we're looking at the underlying degree of inflammation that would be present. Here it's coming around to 0. Again, normal blood work, score will be 0. So from a rheumatoid factor standpoint, an antibody standpoint, and an inflammation standpoint, C-reactive protein, erythrocyte sedimentation rate, that's all coming back as 0. So only now are we at 5. But then we have the duration of symptoms. It is beyond 6 weeks. It's been going on for about 2 years. So with that, that is 1 more point. 5 plus 1, 6. So if it's 6 or greater, then that's where we would conclude that a rheumatoid arthritis diagnosis would be appropriate. Not everyone that has a rheumatoid arthritis diagnosis requires positive findings on a blood test. If you have sufficient number of joints, as well as length of time, it would be sufficient enough for you to have a positive diagnosis of rheumatoid arthritis.